This lecture will cover the dimorphic fungi, which are some of the organisms that cause systemic mycosis. While the book does refer to the dimorphic fungi as systemic, you should also note that there are other organisms that cause systemic disease, like Cryptococcus, Candida, and Aspergillus. What sets the dimorphic fungi out from the other fungi is that they do have both a yeast and a mold phase. In the past, one of the tests that was done to kind of confirm that a fungi was dimorphic was to do a culture conversion, where you take the fungus that's growing on a plate in the mold form and place it in an incubator at 35 to 37 degrees to see if over a course of a few days if it would actually convert to a yeast form. Dimorphic fungi are able to cause infections that affect other organ systems throughout the body. These infections can vary in severity, and patients who are immunocompromised tend to exhibit the disseminated form of the infection. Primary infections involving dimorphic fungi typically are pulmonary related, and they're usually asymptomatic and cause no sort of lingering effect and are self-limiting. It can progress to an acute or chronic disease, and it can also cause a granulomatous type lesion. Yeast can enter the lymphatic system through macrophages, at which point they can disseminate into other organs. Disseminated infections are very fast and they can potentially be fatal. So we're going to look at the most common dimorphic fungi. The book does list several. Some of them do not go into very much detail about it, but I'm going to try to cover as much as I can about these. Blastomyces is the causative agent for blastomycosis. And blastomycosis is an infection that contains a mixture of pus-producing and granulomatous inflammation. This is also known as Gilchrist disease. These infections can be acute and chronic. You can see an example of a chronic cutaneous blastomycosis here with this nasty ear. It's an ulcerative type lesion, and it typically affects the exposed tissue or the mucocutaneous tissue. If blastomycosis becomes systemic, it can involve any organ, including bone lesions, osteomyelitis, and you should also note that blastomycosis can happen within dogs and humans. So dogs can actually get a cutaneous type lesion that looks very similar to this. This is a much better picture of the Ohio River, which is one of the places in North America where you can actually find Blastomyces. And that's because it's a soil saprobe, and it's usually within the soil or the wooded type areas where there's some sort of decay. And individuals can get Blastomyces through inhaling the organism through the mold form of it. Some of the specimens may be sputum or some of the subcutaneous tissue, skin scrapings, and possibly blood and urine, depending on if you're doing some sort of serology type testing. Anytime you collect a specimen for any sort of culture, of course it should be done with an aseptic technique where you're using a sterile collection device, as well as ensuring that the area is cleaned as good as possible before collecting the specimens, so that you don't get any sort of contamination through normal skin flora. The appearance of Blastomyces on a fungal culture would be slow growth with white to beige colonies. A 37-degree culture or a routine culture on regular blood agar media would appear yeast-like with wrinkle folded type colonies. The microscopic appearance of the mold form would be fine septate hyphae. So you can see a picture of this to the side where you have the very fine hyphae. You can see some of the septate type divisions within that hyphae. You can also see the conidia that are growing directly on the hyphae, and then you can see some that are also projected off that look similar to a lollipop, where they're just kind of coming off the side of it. If you were to look at the yeast in the 37-degree type culture, it would just kind of be one single bud, and sometimes it would have a broad base. Some of the additional tests that would be used would be PCR testing or serology, looking for some sort of antigen antibody type reaction. Here are some more pictures of Blastomyces. You can see again the fine hyphae in these two images here on the end, where they have the conidia directly on or slightly coming off of the hyphae. The two culture views, you can see that it's got that tannish type look. This one's a little bit more kind of rigid, and you can see some that's a little bit darker beige color. Here at the bottom you can see a wet mount with the broad budding yeast, and these two cultures to the side, that's purple so you can't see it well, but these two again show those yeast with the single buds. Yeah, that's not a pretty picture. Coccidioides is the cause of Coccidioides mycosis. And this is a respiratory type infection that can be self-limiting or it can be chronic. It's also known as valley fever. It is a primary infection that's usually asymptomatic and self-limiting, but it can also be a disseminated type infection, which can not only involve the respiratory tract, but also the skin, as you can see here, bones, joints, lymph nodes, adrenal glands, and even the central nervous system. So based on this picture, where do you think you can find Coccidioides? That's right, in hot semi-arid climates like the desert. So southwest United States deserts, northern Mexico, Central and South America. So it is a soil saprobe, and it can be inhaled through the arthroconidia that are in the soil from the mold form of Coccidioides. It's an occupational type hazard, and sometimes it's inhaled during sandstorms. Specimens would be sputum, skin scrapings, blood, and urine. So the mold form of Coccidioides growing on routine fungal cultures would appear as a fluffy, white, cottony looking mold, otherwise termed as cobweb. And so anytime you see a mold that looks like this, it's considered a very hazardous mold. So typically you use a lot of caution if you see anything growing on a fungal culture that's fluffy and white, because just taking that top off can create those arthroconidia can come into the air, and it can create an environment where the workers can actually breathe that mold in. So the microscopic appearance would be, for the mold form, septate hyaline hyphae with arthroconidia that are a barrel shape. So if you can kind of associate the desert being dry, needing a lot of barrels of water, then you might be able to associate this appearance with that whole concept of identification for the Coccidioides. Now, the culture typically grown in a lab doesn't produce a yeast form, so that's why that's not listed on here. However, you can see it in direct skin scraping type specimens where KOH is used. And what you're looking for with those is the presence of spirals with endospores, which is very diagnostic of the Coccidioides within those samples. Additional testing would be PCR testing and serology. So here we have Coccidioides growing in fungal culture. Here at the bottom you can see it's white and fluffy. Up top you can see the white and fluffy. However, the flip side is a little bit darker. The microscopic appearance, you see those barrel shapes with the septate where there's divisions. And then up top you can see some of those divisions with those barrel-shaped arthoconidia. You can also see in the direct specimens with tissue or both of these do appear to be tissue. But this particular one up here at the top, you can see where the spiral has come open, and you can see those endospores that are starting to come out. Ew, histoplasmosis. This is a chronic granulomatous infection that begins as a respiratory illness, and then it can eventually invade the reticular endothelium. And this is caused by Histoplasma capsulatum. It is also known as spelunker's disease, and this is because of the spelunkers, also cave explorers, that get exposed to this when they inhale the aerosol conidia or the small hyphae fragments. This disease can also mimic tuberculosis, and that's because it can cause ulcerative type lesions in the upper respiratory tract, as well as the other symptoms that it causes. The disseminated infection can progress throughout the reticular endothelium system, with primary sites of dissemination being the lymph nodes, liver, spleen, and bone marrow, but it can also infect the kidneys and the meningeal layer of the central nervous system. Histoplasma capsulatum is claimed to exist worldwide. It is, however, endemic to Midwestern and Southern United States. You find this within contamination of soil with bird droppings and bat excrements. So you can see this a lot of times in farmers who have chicken houses, and they get exposed through cleaning up those chicken houses and getting exposure through those the chicken feces. And what happens is once it gets in the air, then they breathe in those spores. Specimens of choice are lung biopsies, blood, and bone marrow, and it can be seen as an incidental type finding with blood and bone marrow type stains with the right stain. The macroscopic morphology of Histoplasma capsulatum going in a fungal culture will appear as a tan, fluffy, suede looking or cottony type colony, and the flip side would be pale yellow to brown. At 37 degrees, it appears a yeast that is smooth and white, and it can be tested through culture conversion. However, this is not used much anymore, and that's because that there are other methods out there like PCR and serology that are easier and quicker to perform. The microscopic appearance of Histoplasma capsulatum: at 25 degrees, the mold form will appear as fine septate hyphae, and these will have macro and microconidia. And with these macroconidia, you can see over here where they have these little projections around the edges. And so this is one of the ways that you would identify it. You can see these fine hyphae. The yeast form will have a narrow neck on the bud. And if it's intracellular, those yeast will look round to oval as well. Here we have some images of how they would appear growing on culture. You have that white look with the reverse side that's tan. And this looks like it has probably aged some in this culture. This would be the tissue type specimen. And you can see growing here in the center on culture as well, where these look kind of yeast-like. And again, you have just those single yeast cells here in this tissue specimen. Here at the bottom is just an image showing those projections where you have the macro, the large, and the micro conidia coming off of the hyphae. And again, you can see those septate divisions. Sporothrix is the cause of sporotrichosis, which is also known as Rose Gardner's disease. So talk about your green thumb. So what this does is cause a chronic cutaneous and subcutaneous type infection. And what happens is it will start as a small non-healing type ulcer, and then over time it can develop into a nodular lesion that will start to move towards the subcutaneous tissue and then later the lymphatic system. It may cause a chronic type condition, but it rarely progresses any further than just those lesions. Pulmonary sporotrichosis is rarely caused by actually inhaling the spores. Sporothrix is found worldwide, and it is isolated from soil, living and decomposing plants, wood, and peat moss. So the infection happens when there's some sort of trauma to the hand, arm, or leg, and this is usually by thorns or splinters or some sort of bite or insect sting or a scratch. So this is considered an occupational type hazard for farmers, nursery workers, gardeners, florists. The specimen of choice is anything from the wound itself, like the pus, or the lesion itself, the tissue from around the lesion. Sporothrix, based on the morphology growing on a fungal plate, is that it is a rapid growing mold, white to cream to brown. It is velvety and wrinkled, and as the culture matures, it will turn dark and flat. At 37 degrees, it does appear as yeast with a cream to white appearance. When you look at it microscopically, the mold form will look like very delicate thin hyphae. So you can see several of those over to the side where it is very thin. They look very delicate, and they can resemble ropes. They are septate, so you can see those divisions within that hyphae. You can also see the conidiophores will produce several conidia on it that look kind of like a little flower arrangement. So off of the hyphae, so you have the long hyphae, and then you have the conidiophore that holds up all of those conidia. And you can see this one over here that looks a lot like a flower would. So this is a good way to associate this with the type of disease that it causes with, gardening flowers. The 37-degree microscopic appearance or from direct specimens would have a round to oval cigar shape to the yeast cells. Here you can see in the top corner where the specimen has those rounded cigar-shaped type yeast cells. You can see some that are a little bit more rounded, whereas you see some that are a little bit more of a elongated cigar shape. Here's a good image of those conidia on top of the conidiophore that have that flower look to them. Here is a nice example of a white yeast colony. And then you can see the tan appearance on an agar plate. And then you can see the dark look that it gets once it ages. Paracoccidioides brasiliensis is the cause of Paracoccidioides. This starts in the lungs and it spreads to the mucous membranes, It is asymptomatic and self-limiting, but it can disseminate to other tissue and cause a cutaneous disease, like pictured here, where it has infected the mucous membranes. It is found in South America, Mexico, Central America, and Africa. It is a possible soil saprobe. Specimens would include tissue biopsy, blood, skin, and urine. It is identified based on the slow grow rate on fungal media that is white, heaped, and folded. At 37 degrees, it is yeast-like with a cream to tan moist colony. The microscopic morphology for the mold form appears fine and septate with hyaline hyphae, but you also have a few microconidia along the hyphae. The yeast form will appear with multiple thin neck buds. And you can see a picture of that here where you have the large form, but then off of that you have several very thin neck buds. So you can see the thin necks here, but you have several buds off of one mother cell. The direct specimen would appear like this, and this is also termed as a mariner's wheel. Additional testing that could be performed would be PCR and serology testing. Here again you can see more images of that mariner's wheel. This would be in perhaps tissue samples where you could see this type of morphology, where you have the mother bud in the center with thin net buds off to the side. And here you have those heaped colonies in this culture media that has sort of a tan appearance to it. And here we have a review of the morphology with the mold versus the yeast form. With Blastomyces, you have the hyaline hyphae that is septate. This picture doesn't depict those divisions, but then from there you have the conidia that comes off that looks sort of like a lollipop. Then you have the yeast form. Coccidioides has those barrel-shaped arthroconidia. And then you have the spiral with the endospores on the inside. Histoplasmosis, again you have septate hyphae. And then you have those projections that are around the edges of the conidia. Then you have the yeast form. Paracoccidioides, you have those septate hyphae. And then you can have the microconidia along with the cells, the yeast cells that have multiple budding around the edges, looking like a mariner's wheel. Here is another picture that also includes the Sporothrix. And I also want to make mention that several of these may not be endemic to the United States. However, it is good to know them for the simple fact that people can travel outside of the United States, become infected, and then come back to the United States. So you still need to be familiar with them as far as pathogens.